All right, well, welcome back everyone to Systemic. I'm your host, Dan Kimbrough, and today I'm here with Angela Odoms-Young, who is currently at which institution?
At Cornell University in the
Yep,
Division of Nutritional Sciences.
Yep. All right. And I want to thank you for taking some time today. In this sort of section of Systemic, we're going to be looking at healthcare inequities. And I invited Dr. Odoms-Young on to talk about some of the historical issues that have led to how we've gotten here when it comes to food insecurities and food dignity. And you, and this isn't a paraphrase, not a direct quote, but you talked about when we look at sort of how we're moving forward with looking at healthcare inequities and disparities, that there's a systemic issue historically that has caused all of this, and that we're hopefully getting to a point where instead of patching up the genes, we're going to start looking at how do we get a new pair of genes and move us forward. Talk about the idea that historically, we've been patching up this systemic racism issue when it comes to healthcare, and that maybe it's time to start looking for a new solution.
hmm I think that's really important because traditionally, if you look at healthcare or you look at health behavior specifically, like
Mm-hmm.
dietary behavior, the
Mm-hmm.
focus has been very individual. So the idea that you make choices, other people make choices, and we don't look at life chances. And so
Mm-hmm.
if we think about people that have been survivors of systemic oppression, that
Mm-hmm.
becomes really important. I mean, our food system in general needs to be improved for everybody, but people of color, and when we look at low income populations, access is key. And that access
Mm-hmm.
is not just today. We think about a grocery store today,
Mm-hmm.
but the biggest environmental impact on the African American diet, for example, is the history of slavery. So when we need to look at the legacy from sort of the beginning, or
Mm-hmm.
our beginning in the United States on. So
Right.
it's really expansion of the issue, not
Mm-hmm.
necessarily a new issue. And so we look at patches, we look at temporary fixes, but we need to look at root causes, income inequality. People don't always think about housing, and how
Mm-hmm.
that contributes to wealth. So it really is a complicated issue. It's not just a very simple issue like, I'm going to give you food, or did
Right.
you choose to eat a Big Mac or an apple? It goes deeper than that. And we need to
Yeah.
look at social structures and
Mm-hmm.
how it can help support people live healthy.
Yeah, and talk about the importance of wealth and some of the articles that you shared in talking about food disparities. So many of them talked about the wealth disparities and historical wealth gap in the U.S. between black and white, or even non-white and black in this country. Why is that so intrinsically intertwined when we're talking about health and nutrition and food?
So I think we need to look at food in our experience in the United States as being closely linked, and wealth is
Mm-hmm.
part of that. We were brought here to generate wealth. So if you look at the history of agriculture and labor and uncompensated labor, the
Mm-hmm.
generation of food and engaging in labor also resulted in the lack of wealth. So if you think about sort of that start of being years of engaging in uncompensated labor, not receiving, income
Mm-hmm.
after that. Essentially, a lot of people, particularly scholars that look at wealth inequality, talk about starting behind.
Yeah.
So it's not unusual to think, okay, well, food insecurity exists today. Actually, food insecurity in the Black community is twice that of the
Mm-hmm.
white community. But there's a book about what slaves ate, for example, that I was looking at, and they interview people right after slavery, and a lot of those people were food insecure. So
Okay.
if you think about 3 generations, 2 generations of poverty, then that becomes a major contributor because you need income to purchase food, you need income to
Mm-hmm.
purchase housing.
Right.
And so a lot of it was also not only rooted in labor explicitly, but also policies that were
Mm-hmm.
associated with labor and racial segregation. Are there certain policies in place that keep you from generating wealth? That keep you from, purchasing a home, which is really a wealth creator.
Mm-hmm.
So all of those things are really important when we think about diet, not just other things like education,
Hmm.
um, which or housing. They also result in inequities that exist in health.
And one of the things that I found that was interesting, and doing some research before this conversation, is that when we talk about wealth, wealth is a long-term sort of grown thing where income is the here and now. Can you speak to that difference and why
Hmm.
it's not so much about the income that you're creating today, but about the wealth that your family either has or does not have from the past?
Hmm. That's particularly important. Even in studies, we traditionally measure income. What
Hmm.
does a person look like right now? That also doesn't speak to their entire financial picture
Right.
because it doesn't speak to savings. You know, a lot
Hmm.
of times people talk about folks being one check
Yeah.
away from poverty, or many people of color had downward mobility. So we don't
Hmm.
always think about this idea that wealth is important because it helps you avoid any type of economic shock.
Hmm.
Because if you lose your job, you don't have income. I mean, income is important, and we know
Right.
wage inequities are important, but wealth helps people maintain well being because
Hmm.
it contributes some significant stability.
Right.
So
Right.
people are able to recover. COVID is a prime example of an economic shock. But not only COVID, Hurricane Katrina and other things. What happens if somebody has an unexpected expense, like a medical expense? What happens if you lose value in your home?
Hmm.
All of those things will put you potentially in an economic, sort of a dire straits position that is different than income. That's wealth.
Yeah.
And so when it comes to food, we spend money. Food is an expense that we have consistently. We
Hmm.
need
Hmm.
food to live,
Right. Right.
but
Right.
we also need rent. We need utilities. We need water. And
Hmm.
in some places, the water expense. So water is not free. So all of these things play a role where people may not have that income
Hmm.
to purchase food, but it also may drive them into poverty that makes it difficult to make ends meet. I know along my career, I've interviewed people that are food insecure, and people have a picture of folks that are food insecure. They don't always think about people that have been to college or had some
Hmm.
college. But college debt, of course, is an
Yeah.
issue as it relates to that. So it becomes a complicated issue that can be very, I guess, viewed in a very simple way, in a sense that people need resources to live.
Yeah.
And food is part of that
Hmm.
living.
Can you talk about what is food insecurity? I think that it's a term that is, at least for me, over the past 2 to 3 years, has become more and more prevalent. But it's not just hunger; it's something that's much deeper than the idea that this person is hungry. There's a lot more that goes into that. Could you talk to that?
Mhm. So, food insecurity is a social and economic condition at the household level.
Hmm.
People fear that they may run out of money, run out of food, and not have money to buy more. Food is inconsistent, so people experience food anxiety. So,
Hmm.
there's a psychological component that goes along with it, it's a physiological. So, we don't think of food insecurity as being equal to hunger, but hunger being a consequence of food insecurity, that instability within a
Hmm.
household where you potentially may be without food, either quality,
Hmm.
quantity, variety, and many people think about the extreme end, what we think of as very low food insecurity, but there's also marginal food security, low food security, where
Hmm.
people start to sacrifice both quality and quantity of food. And all household members don't experience it equally. As you would guess, that young children, that parents try to preserve, or protect young children from food insecurity. So,
Right.
mothers or fathers may experience that food insecurity. Teenagers that we don't always think about. to
Mm-hmm.
protect young children and siblings from that experiencing that lack of food. But that anxiety translates into the entire household. If you were a
Yeah.
parent and you thought, okay, I have a college age daughter, to say, Mom, I want something to eat, your feeling is going to be that
Right.
deprivation has a mental health impact.
Right. And so it's not just the physical, I'm hungry in this moment, or the worry, but it's also the mental impact of where is that next meal, or how do I protect my child from realizing this? But you even talked about like the notion that you've graduated college, but you still may be food insecure, or you may be elderly and you are still food insecure. It's not just
Hmm.
sort of the core family or the youth, but like anyone in the world, anyone at any point in their lives could be dealing with some sort of food insecurity.
Hmm. I mean, that's anything, I'm not sure if you looked at your grocery bill lately, you know, and then
I try
also
not
with
to.
inflation, right? So, if you don't have access to some of those supports, so things like SNAP
Mm-hmm.
or the charitable food system, it can keep people from experiencing that food anxiety. Now, that's a meantime strategy in a sense. We want people to move, SNAP is probably the biggest response that we have to food insecurity in the United States. And honestly, for some people, it's still not enough
Mm-hmm.
because it is a supplemental benefit, not the entire pie, so to
Right.
speak.
Right.
But and a lot of families that receive SNAP have disabilities, the seniors, they're working.
Mm-hmm.
So I think when we think about food insecurity as this sort of persistent, or sometimes cyclical experience in the United States, it has an important impact on health, and
Yeah.
it is you know susceptible to that possibility that unfortunately we all could be faced with that experience because of a significant health problem, as I mentioned,
Mm-hmm.
loss of job and loss of income without savings, loss of housing. All of those factors can play a role.
And so, and sort of taking a step back, and so in today's world, sort of we're looking at, you talk about housing, which redlining for Black and Brown communities. You didn't either. You were moved out of where you were, or you're in areas that are extremely high population, very low access to sometimes even structures just to get out of the community to get to work, food, all these different things. There's all these things that are happening today that are sort of the end result of very early systemic racism and all these things.
Hmm.
How have we gone? It's realistically we're looking at 120, 200 years, depending on when you want to start this. How is it that as a society we still are dealing with this? Like, and you look at the data and it almost goes through waves. Like you'll see moments where the wealth gap and even the security gaps get a little bit narrower, never go away, but then they explode back up. And so there's almost waves of this happening throughout history. Why haven't we been able to solve this? Why is this still something, specifically in Black, Brown, and indigenous populations, this is still an issue? We can't feed our own people.
Hmm. So, you know, it, we really have to deal with the root causes. So, if we
Mm-hmm.
think about a race and somebody's running a race, and you start yesterday and I start today, trust me, you're going to be probably, you can run faster even. You're going to be farther along than I. And
Mm-hmm.
it's important that we figure out a way to close that gap, that we have
Yeah.
policies, honestly, that start at birth or preconception
Mm-hmm.
to really invest in closing that economic gap. And honestly, I'm
Yeah.
not even convinced totally that if we close that gap that some of these disparities won't still exist, but we will be able to advance,
Mm-hmm.
towards that. It might take a while. It won't be overnight.
Yeah.
But the income gap is probably one of the biggest um, predictors. Poverty is not always associated with food insecurity, but the idea of a gap,
Yeah.
this gap that exists in wealth and in income, not at an individual level, but an entire community level,
Right. Right.
at a population level. So
Mm-hmm.
it's not that we haven't tried to solve some of the issues, but
Mm-hmm.
um, I think we can make a more significant investment. It's very difficult to deal with the problem that's happening today, like
Hmm.
food insecurity, addressing that immediate need. And so, if you look at the charitable food system, for example, like our food pantries, our network of food banks, the focus is on feeding people today.
Right.
Now, even they're starting to think about the idea that we need to look at tomorrow. We need to look at this idea. Yes, it's good to feed people today, but if we don't deal with these systemic factors,
Hmm.
investing in education, in the immediate need of job training and employment, we know mass incarceration has had a huge impact on economic stability within families. So,
Hmm.
how do we look at addressing those factors? And that
Yeah.
becomes that, I think, will help us long term. And then stigma and discrimination is still something that we need to try to address. Martin Luther King, I saw a wonderful sort of interview not long before Martin Luther King was killed about this idea of once you make something a thing, it's
Hmm.
hard to reverse that. So he was talking about humans.
Hmm.
Essentially, once you dehumanize a
Okay.
population,
Hmm.
how do you make that population human again? And that stigma of racism may
Yeah.
continue if we don't deal with some of the root of that and really change it, not only hearts and minds, because we know that we have to change policies
Hmm.
and
Hmm.
also communities and environments, but we can't underestimate the importance of bringing hearts and minds along with it.
Yeah, and that's really interesting that you said that there was one of the articles that you sent over. There was a discussion about the idea of the individual versus the system. And the idea that when we think of poverty or we think of hunger and all these things, we think that the individual did something wrong. We may still be willing to help, but we're viewing him as you did this to yourself. Like you're in poverty or you're hungry because you've made a mistake, which is us ignoring the systemic issues, right? That no, historically, this group of individuals has dealt with insecurities and disparities. And so this individual may be dealing with the end result of a systemic historical advancement. Why is it important that we have to look and call out racism, call out whatever ism it is that caused the individual to be hurting? Why is the calling out of the bigger picture really important?
It's really important for everybody. We think about, we value, even in the Black community, we value resilience
Mm-hmm.
and kind of durability. I don't know how many people like I overcame that. Like I was resilient. I was able to overcome X.
Yeah.
And sometimes the idea of slavery, you've heard people say all kind of crazy things like I would have run away, and you know what I mean. Like, so you're like, what? But this is like a system, and if we don't deal with systems, there will always be, of course, there is going to be a varied response. Some people
Mm-hmm.
are going to be able to be resilient,
Mm-hmm.
but that doesn't mean that they haven't been impacted. A lot of times, if you look at even wage gaps, for example, one of the biggest wage gaps is not of people that have high school diplomas, but of people that have advanced degrees.
Oh, wow.
So part of this idea about where would people be if some of these systemic factors didn't exist, we think, oh, that person's doing okay, they're not living in poverty or they're not homeless. But we would all do better,
Mm-hmm.
because the other thing that we don't talk as much about is the impact of systemic oppression of people of color on the entire society.
Yeah.
So part of this idea that you think is just the people that are survivors of systemic oppression, but in a way, we're all survivors
Mm-hmm.
of systemic oppression. How does that mute the possibility of a society to advance when we invest in all people? What is happening when we have people experiencing food insecurity? What could those people be contributing to
Yeah.
society? Instead, they're worried about where is my next meal going to come from?
Mm-hmm.
So we're all linked. And so dealing with systemic factors help create a better society. I mean, there's several studies, both internationally and domestically, that talk about how income inequality, not just absolute poverty, but how income inequality contributes to poor health in a county, poor health in a country. And so
Hmm.
all of those things can really play a role in improving outcomes for everybody. And it's not just individual, like you failed, like you can't take care of your family. Well, guess what, some of, like I mentioned before, some of those people are working, they're
Hmm.
investing, they're paying taxes. And so a lot of times we think, okay, well, it's your fault. But if we set up a structure where everybody can succeed and think more upstream
Hmm.
instead of downstream, again, that analogy where people fall into the river and we are pulling them out one by one, guess what? They're falling into the river because there's no fence. They're not
Right.
just falling. So if we build more fences
Hmm.
to keep people from falling, then they can also engage and contribute to society in a more robust way, because and then that benefits everybody.
Yeah, and I really like that example of, yes, we need to continue to pull the people who have fallen in the river out, but let's stop people from falling in the river as well, so that we don't have to continuously do these individual things. Let's just stop people from falling in, which is also acknowledging the river is a problem. you know
Right.
like,
Yeah.
there's a river here, we have a problem, let's figure out something. And so you're
Right.
dealing with the past, you're preparing for the future, but you're
Uh,
still dealing with that immediate need. I like that analogy a lot. Looking forward, what are some of the solutions? What are some of the things that are being done? What has research shown us as sort of tracks of how do we move forward? I know you said that you don't think it'll be fully realized, but how do we make any
mhm.
progress at all? What are some of the things that are being done right now?
So I think in the very short term, equitable access is important. Stores, for example, or other types of innovative, like planned community developments within these communities that are worker owned, or institutions within communities like church or faith-based institution owned,
Hmm.
retail outlets. They can help farmers markets, urban farms. All of those things I think are really important if we bring them to scale. One, they're businesses. So, how
Hmm.
do we invest in the businesses in communities of color, where they provide jobs, expand the tax base? That's, I think, important. Investing in businesses, investing in people. So, racism is a traumatic experience. We
Hmm.
need to look at trauma focused interventions to heal people from the trauma so they can be more whole, honestly. So those are investments. We need to invest in attainable housing. We think a lot
Hmm.
about affordable housing, rental housing, but we also need to invest in home ownership,
Hmm.
and
Hmm.
also help people with maintaining those homes. There's other types of things like baby bonds and being able to invest in people when they're born, to think about equity. A lot of people, when you have a wealth gap, may start without wealth.
Yeah.
So, how do we help really invest in things like baby bonds or early childhood, for example, so people can have a healthy start?
Hmm.
Within hospital systems are really expanding to address things like food insecurity through food as medicine programs,
Hmm.
as well as looking at other types of supports within our healthcare system, like law clinics. People don't always think about law clinics.
Mm.
If you have some type of, you can end up unjustly, owing
Yeah. Okay.
something or your house being taken. So, believe it or not, the healthcare system is starting to look at law support, law
Hmm.
clinics, those things that can be part of. We don't always think about those things impacting your health.
Yeah. Yeah.
So, we need to try to address those things that put people behind. Many times we think about those as individually, and because maybe we're addressing it individually,
Hmm.
like eliminating medical debt, but that can have impact on the entire society. And then we're also going to have to look at restorative policies. What those restorative policies are, people debate, can we close this gap through all these different restorative policies? But we have to be realistic about the restorative policies because we can't, we have to figure out what might be the best approach because in some ways, a burden on government may be difficult. um, a lot of times people in philanthropy are also thinking about investments,
Hmm.
because these aren't really just social service programs, they're investments. So
Right.
how do we look at community investments and ROI? I don't think we have to only look at that, but we really have
Yeah.
to think about building communities, building strong communities, building businesses, economic stability, not just sort of a social service mentality of helping.
Hmm.
And I think that that can help close gaps, jobs, money, maybe food in the meantime, but how do we leverage really restructuring society so that Black communities are economically stable?
Yeah, and that's
And
and
Black and
it's
brown communities,
yeah,
I'm
yeah.
sorry, Black and brown
Mhm.
communities
Nope,
are
nope, nope, nope.
economically stable.
And it's interesting because I think about in a conversation around food, you're talking about housing, you're talking about jobs, you're talking about mental health, you're talking about transportation, like all of these things that have been, and they're all tied to the same systemic historical issues within this country. We saw, not that we can solve, but we deal with racism. How many things do we start checking off the list or start making big
Hmm.
progress because we're removing race? And so I think it's interesting that in this conversation around food, there are so many other things that lead up to access to food that we're not always thinking about, and like this level of intersectionality. And I think it's amazing how do we get people to realize it's a bigger issue. Like it's not just the food on my plate at dinner tonight. It's how do I get to the store to get the food? How do I get the food home? How do I pay
Hmm.
for the food? Where am I cooking the food? Like how do we get people to realize it's so much more than just a meal in front of me?
Hmm. We really need to talk about both. We get so focused on consumption,
Hmm.
the end result, you know, consumption. And we still believe this perception of choice, not chance. I think
Oh,
shifting this idea from it's not just choice, it's structural factors that are shaping choice, including marketing
yeah.
in food marketing. We can't forget about that in targeted marketing.
Yeah.
And I want to make sure to emphasize this idea. Racism is part of that, but it's not either or, it's more. We
Mm.
have a broken food system that needs to be restructured in a sense that impacts everybody. We
Yeah.
can't forget about low income white families, a lot of
Hmm.
families that live in agricultural communities, a lot
Hmm.
of Black and brown agricultural workers as well. They're, producing food, but struggling getting adequate food based on income and availability.
Yeah.
So, this idea of kind of targeted universalism, if we deal with people's challenges that may be the most at risk, we can help improve society for everybody. And
Mm.
we need to shift and get people to start to think about society matters. We're not against each other.
Right.
The idea is that structures matter and they're shaping, it's not, we think we have so much control, honestly, but shifting that conversation to have supportive societies is critical.
And could
And
you go a
how you
little?
do it, it's difficult. You know
Yeah.
what I mean?
Well, yeah.
Because you got to kind of push people, but sometimes it's hard.
Yeah, yeah. And can you speak a little more on that idea that if well, yeah, we don't want to forget about non-black or brown communities that are struggling with income and food and all these other things, but how if we help those who are in the most need, we end up lifting everyone. Can you speak a little bit more to that?
Yeah. So a lot of these solutions are, they can be designed where they can help, it's like a rising tide lifts all
Mm-hmm.
boats.
Yep.
And
Yep.
so
Yep.
this idea that we can't all win. You know, we're always kind of thinking about this idea that we can't all win. But if we restructure food systems and we look at those supports for Black and Brown communities, some of that is through a poverty pathway.
Yeah.
So it's not all going to be addressed by addressing poverty, but some of it can be addressed. I mean, we do have to address racism, don't get me
Mm-hmm.
wrong.
Mm-hmm.
But one way that racism operates is through poverty.
Right.
So if we create opportunities, but it's a layering, it's, as you mentioned, that intersectionality. It's
Mm-hmm.
like you add race, you add poverty. Let's not forget about sexual orientation and
Mm-hmm.
gender identity, because
Mm-hmm.
LGBTQ plus populations are more at risk, both in Black and white and Latin, or Latinx communities. When you
Mm-hmm.
look at comparatively, so it's I like to think of it as not just race,
Right.
and then we go to racism, but
Mm-hmm.
really thinking about these layers of oppression.
Yeah.
So people in low income white communities do have a layer of economic, oppression. But if we layer that with race and
Right.
racism, and we
Mm-hmm.
layer that with adding, sexual minority status or LGBTQ plus and and gender identity, we
Mm-hmm.
see that there's sort of a layering.
Yeah.
Um, and so part of that layering, if we look at addressing again structural oppression itself, that concept, what can we do to reverse that?
Mm-hmm.
Whether it be income, race, then those models can help
Yeah.
alleviate a lot of the burden for everybody.
Well, yeah, because then you're scaling, right? If you figured out poverty in one
Scale.
group, how do
Mm-hmm.
you replicate and scale to another group? And then, well, we've tackled poverty. Yep, racism is still an issue, but we're feeding the people now. Now let's move on to
Mm-hmm.
housing. No, racism is still an issue, but now people are being housed, and it's that stacking it up, and eventually, like, no, we took care of racism. No, remember when we took care of all of these things that were plaguing society? That helped knock out all of this over here as well. So, and I
Mm-hmm.
like that. So to the person who still doesn't get it, nope, you have made the choice. You are the reason you're poor. You're the reason you're hungry. You're the reason you're homeless. What do you say to that person who
Mm-hmm.
ignores all the data, the research? What do we say to try to get that person, or do we give up on them? What did you say to that individual?
I think the first thing as a researcher, and we haven't done a lot of this, we've studied the impact of these things, but
Mm-hmm.
not the sort of mentality that contributes to the thinking about the, self blame. And I'm
Yeah.
really curious. I think just like anything else, we need to dig deeper and understand more about why a person, you can't really address something unless you understand why a person came to this
Mm.
conclusion. And honestly, I think we need to start in early life, like maybe not as early as preschool, but start trying to understand the development of this perception in teenagers,
Mm-hmm. Mm-hmm.
in middle school, because it doesn't come when somebody is 50. It
Right.
normally evolves over time. So I would say to that person, uh, let me interview you. Tell me more about your life experience, because what we
Mm-hmm.
can do is restructure those experiences. I've come in contact with people that think very differently, although they are from a totally different experience. Then they didn't live in poverty, they
Mm-hmm.
lived in wealth, and for whatever reason, they came to a conclusion and they have a good understanding of this.
Gotcha.
How did that
Gotcha.
happen? And we need
Yeah.
to look at those models of how people start to engage and lean into social justice.
Mm-hmm.
Um, I'm UCC, for example. I'm a member of Trinity United Church of Christ on the south side of Chicago. And we've had people that come to visit that church that if you saw that person on the street, you would be like, okay, this person is for sure. They would not understand this
Mm-hmm.
perception. But we need to learn more about how to change hearts and minds and how to change knowledge where people understand. that is systemic. And that comes through training, it comes through exposure.
Gotcha.
A lot of this is just limited exposure. And then in some people, it's self serving, it's power.
Yeah.
And so I think if the power conversation becomes a very difficult one.
It's an entirely different conversation. I agree.
Exactly.
I agree.
Yeah. So, what do you say to those people? Let's have coffee.
I like
and
that.
then and then you might have to say not coffee today, maybe coffee in a few years. But one thing that I've seen with seniors, for example, people start to understand some things when they age that they didn't understand before. Not always.
Yeah.
But, so part of it is, I think, exposure and experience. And then we need to engage in more training and education programs that help support not only those that are disproportionately impacted, but those that have power.
Gotcha. I like that. Let's have a coffee. Rather than shun them away, let's invite them in and try to figure out where they're coming from and then go that route. I like that a lot. Well, Dr. Odoms-Young, thank you so much for your time today. If folks wanted to reach out and have in further discussion with you, if they wanted to invite you out for that cup of coffee, what's the best way for them to reach you?
Is by email, Odoms-Young at Cornell.edu.
All right.
So
well, thank
Odoms-Young.
you. Odoms-Young at Cornell.edu. Thank you very, very much. And that's it for this episode.